I received a phone call around 8 p.m. on a Tuesday evening to report to Joint Base San Antonio to go on an ECMO mission. For me, this was a lifelong dream coming true. I had just joined the Air Force in January, and I wanted to do this kind of work. The ECMO team is a special team comprised of highly trained nurses and doctors that go around and save some of the sickest patients in the world. The ECMO team in the United States Air Force is a great team because they are one of the only teams that are able to fly with ECMO and have the capabilities for air transport. They operate with the Air Force's 59th Medical Wing as well as the Army. We had to do a lot of preparing and gathering of supplies. We not only had to take the supplies that we needed to do the operation and the surgery, we also needed to take enough supplies for the return trip home back to San Antonio. The number one thing is we need to get to the patient as fast as possible. Therefore, we are under a time crunch. The faster we can get to the patient, the faster we can put them on ECMO, and the greater of the chances of survival. We flew all night through Wednesday, and we arrived on Wednesday morning in Washington, and we evaluated the patient. He was experiencing respiratory distress from COVID-related symptoms. Although the ECMO machine has been used in many different critical illnesses, COVID has been an illness that has really influenced the ECMO world. We have seen a lot of success of ECMO throughout the COVID pandemic. The surgery with ECMO is known as a cannulation. Cannulation is the surgery that we use to put a patient on ECMO. It is where we put one tube in the body to drain deoxygenated blood, and then it goes through the ECMO circuit and reoxygenates the blood. And the second tube that we put in the body is what returns the blood, the oxygenated blood, back to the body. So it works as a lung outside of the body. The cannulation normally takes a few hours to complete, and in this case we were really successful in our mission of putting the patient on ECMO. However, with every ECMO cannulation there are problems and issues that arise because every patient is different. For this particular instance, we had to give a lot of blood products, and we also had to go down to CT to take some images before we were able to even think about our next steps. So once we got the patient stabilized, which took a few hours after surgery, we had to get more people on our team, also known as the CCAT team, the Critical Care Air Transport team, to help us bring the patient back to San Antonio and get them all caught up on the procedure that we had done. It's very risky to transport a patient in the air on ECMO. It's also very risky to just transport a patient within the hospital on ECMO. There's a lot of things that need to go in it, and if one of the cannulas move during transport, the patient's ECMO run would have to stop. We need to get a patient onto a stretcher, and that means all the equipment, the ECMO machine, the chest tubes, every IV pump, everything that has to travel with the patient. We travel through the hospital and take an ambulance then to the C-17 airplane. From there we have to put the patient on what's called a litter, and that is a stretcher that we have to carry onto the airplane. This litter carry is done by multiple individuals. As you can see, about 10 individuals who hoist the patient onto the airplane along with all the equipment. This litter then attaches into the airplane to ensure safety for the individual while en route. Then we can adjust our IV pumps and our ECMO machine. So when we fly, what makes it difficult is you can't hear anything. We do have headsets so that we can talk to one another, but we can't hear the beeps of the alarms. We can't hear the patient's lungs or heart if we were to listen through a stethoscope. because the airplane is so loud. So we have to really be cognizant with our eyes so that we can watch the patient and examine the patient the best of our abilities. Also, being a COVID patient, this transport was more difficult because we had to maintain our proper PPE for our protection as well. Along with this flight, we had infection control nurses that were with us that watched us don on and don off our PPE and made sure that we were safe as a team as well. So when we landed in San Antonio, we then had to get the patient off the plane and take him to Brooke Army Medical Center. Although it will be a long journey for him, I saw we were able to give hope back to his family. And I am so proud to be on this team, and I am honored to serve alongside members of this team.